Yeah, I think we can start because we are recording this session. So thank you everyone for joining this morning's session. So this is in preparation for our Catalyst Cortisol test launch. So as we were saying earlier, with your procurement team, we have starting to stock up your inventory with this test so that after this training, and then you can start talking about it, sharing with our doctors in the field. So this morning's training will be led by Dr. Atit and Dr. Lam. So I think most of you are very familiar with Atit. He's been traveling in your region, in your markets. So Dr. Lam, he's based in Philippines. He is our PSV, or professional service vet. So his role is really, on the client or the vet education. So he's doing a lot of that in clinic education sessions with our doctors, and hopefully soon we will be able to see him in the other Southeast Asia countries as well. So do expect to see him in working with your team in the near future. All right, so I think without taking further time, I'll pass the time to Atit and Lem. Thank you.
All right. So, good morning, everyone. Thanks for taking the time to be here. So, today we're going to be presenting about cortisol and what it is, what it's for, and how the IDEXX solutions play into the diagnostics of it. So, this is our agenda for this morning. First, we have to define what is cortisol and what are the diseases that are associated with it, and demonstrating the proficiency in the workflow of the catalyst cortisol. Okay, and at the end, we have some time for Q&A. So if you could all scan this QR code over here, just so that we could gather our thoughts. So I'll give you about a few minutes to scan it. You could all raise your hands through the chats if you're okay. Great, I see some hands. All right. Okay. So, firstly, what is cortisol? In its simplest sense, the cortisol is the primary stress hormones. So it's released by the body in response to stress, which in turn would regulate metabolism, immune function, blood sugar levels, and also inflammation. So we could expect that in a relaxed dog, the cortisol levels would be quite low. But once they get excited, then the cortisol levels can be high. Okay? So, cortisol is produced in what we call the adrenal glands, which is a pair of small glands that are located just around the kidneys. Okay? And its levels are regulated by a system that involves part of the brain and also this adrenal gland through what we call the HPA axis. Okay? So, you can think of it as like the supervisor, the manager, and then the employee. The hypothalamus would order the pituitary gland, and then the pituitary gland would order the adrenal gland to secrete cortisol. Now, the adrenal gland would secrete cortisol and then do its effects on the body. Now, certain areas of the brain would detect this increase in cortisol levels, which would then stop all the orders to produce cortisol in what we call the negative feedback mechanism. Okay? So when we're talking about the diseases that are related to adrenal function, we're mainly talking about two. So the first one is what we call hypercortisolism, or Cushing syndrome, as it's more famously known, in which the patient has excessive cortisol in the circulation. And this wouldn't be as common as like pancreatitis or any other diseases that we encounter. This would affect around 1 to 2 dogs per 1,000 per year. But what we know so far is that certain breeds, such as these dogs, are more predisposed to developing it. And it's also more common in middle-aged to older dogs. Females also have an increased risk of developing this disease, and also male dogs that have undergone neutering. Now, these are the most common clinical signs that you can see in a patient with Cushing syndrome. So the ones in blue are the most common clinical signs. And they say that a hallmark of this disease is abdominal enlargement and also hair loss and thinning of the skin. Now, the other side of that coin is what we call a hypoadrenocorticism or Addison's disease. And before we move on, I'd like you to take a look at these patients. So number one, we have a pug named Spaghetti. These are all my patients before. And then Feta, Punchy, and then Shaq. So take a look at these patients, and then I want you to let me know, who do you think has Addison's disease in these dogs?
So if you didn't scan the first slide, you can also scan from this slide as well, or you can just go to your browser, go to slido.com, and then just input the session code below.
Let's give everyone a few minutes to answer. So far, we have 5 answers.
Lem, maybe could you go back to the pictures of the dogs again in case we missed it?
Take another look. So we have 6, 7. When we gather around 15 or 20, then we can move on. Okay, so I think that's enough. Most of us answered Shad, but the real answer is Beta. Okay. So Feta is the one that has Addison's disease out of all those 4. And interestingly enough, the veterinarians also go through what you just went through, because we call this disease as the great pretender. Because unlike Cushing's disease, this disease kind of pretends to be other diseases as well. Unlike Cushing's, where you could infer from clinical history, clinical signs, or physical examination, the clinical signs of hypoadrenocorticism is very vague. Okay? So some breeds are also predisposed to developing this disease, and generally around 0.06 of the population could develop this. But when veterinarians are dealing with cases that has chronic gastrointestinal signs, then around 0.3 to 4% of those cases are probably has Addison's. Okay? So these are the clinical signs. As you can see, they're all very non-specific. Lethargy, diarrhea, and vomiting can be caused by a lot of things. And what's kind of interesting about this is there's a case we call an Addisonian crisis, where there would be uncontrollable vomiting, diarrhea, which could lead to severe dehydration and then eventually death. This is one of the emergency cases that revolve around this disease. So, this is how the catalyst cortisol test can help veterinarians navigate this disease.
Okay, so on to my part. Let's go through a little bit on the technical side of the catalyst cortisol. So I think all of us have been quite familiar with IDEXX products by now. So I do have a little bit of quizzes in my slide for you guys to answer. Feel free to turn on your mic to answer them, or you can just type them in the chat. So the catalyst cortisol test looks like this. It comes in a small purple box, and it's only a square slide, similar to what you see with the new SDMA or with fructosamine. And from just the box, I'm sure you guys could probably tell already how many slides are there in this box. Can anyone answer? How many slides are in one catalyst cortisol box? Yes, thank you. So 6 slides. Okay. And because the box is purple, how do we store the catalyst cortisol? How should we keep it? Oh, great. Very quick answer. So yes, we should keep it in a freezer. So purple boxes should be kept frozen only, so that's below minus 18 degrees Celsius or below 0 degrees Fahrenheit. And just a recap, if the box is green, then those can be stored in both a normal fridge or in the freezer. And same with all of our other slides, there's no need to warm up. And since it's only a single slide without a reagent, there's no need to do any dilutions as well. And the range that the catalyst cortisol can read is enough to perform diagnostic tests for both Addison's and Cushing's disease. Okay, thank you, Lim. So let's have a look at how we use the catalyst cortisol. So like with most of our catalyst slides, you can use all sample types for biochemistry. So that means you can use serum in a non-anticoagulated tube. You can use lithium heparin plasma, and you can use whole blood from our whole blood separator. Just one important note is that if you are advising customers to use serum, we do recommend to leave the blood to clot in the tube for around 20 minutes before spinning it down and aspirating out the serum. So you can see that if your customers are using a serum sample, then this is part of the tedious workflow that they have to go through, is that they have to wait for the serum to clot first. And if they don't, what we often see is that the serum that they aspirated out can sometimes just coagulate into a gel-like substance if they didn't do this wait before taking out the serum. So I would say that almost all of the cortisol tests available in the market requires a serum sample. So just the sample type is already one big feature that you can discuss to your customers about that, oh, you don't need to get another separate serum sample anymore. You can just use the lithium heparin plasma and run it with every biochemistry test. And also the sample volume. So if this is the same with all the catalyst slides, is that if they're running only a single slide alone, then the minimum is 100 microliters. But if they are running it with other slides or clip, which is usually the case, then we do recommend 300 microliters of serum or plasma. Unless they're collecting a whole blood separator, then it is recommended to collect 700 microliters of whole blood. And the species that we support at the moment is only canine. This is partially because it is extremely rare to see Addison's or Cushing's in a cat. So I would say almost all of the time, your customers are going to be running it in dogs only. And then the run time is around 13 minutes. So it is quite long, but similar to every other special test that we have available. One note that I had a question recently that is not in the slide is that there is a protocol that sometimes customers may want to run cortisol on the urine. And at the moment, we do not support running cortisol on the urine. So the only test on the catalyst that we support a urine sample is the urine protein creatinine ratio. Alone is also 13 minutes, and then with other slides, it's also 13 minutes. Now, there is some trick to getting a quick runtime when you're running with other slides, is that there is a specific order that you can do to get the fastest time to results, but it won't be less than 13 minutes, and it's not going to have like a big impact. So it may be a couple of seconds or minutes faster. So I wouldn't worry about this too much. It's not life-changing. It's not going to cause any error. But if you put ammonia down first, then light 4, then the clips, and then the cortisol first between any other additional slides, and then total T4 at the top, this is how you can achieve the fastest time to results. Just keep in mind that total T4 is actually something that takes the longest to run, which is 15 minutes. So if your customer actually do run it like this, and they have total T4 in it as well, it's not going to be 13 minutes. It's going to be 15 minutes because of the total T4 slide that's added. Okay, so a little Slido quiz for you guys. So if a customer asks, can I get a summary of a test handling or how to use the cortisol test, which resource are you going to use? So this one is a word cloud, so feel free to type them in. And then once we start to get answers, then the answers will start to show up on the screen. So I'll just maybe give it a minute for you guys to type. Just type in what you usually send to the customer. So here now we see one answer, which is the operator's guide. Yeah, you can also send the operator's guide. It will have every single detail in there. Yes, insert. Just one quick note is that moving forward, you guys are going to start to notice that every single of IDEXX consumables, we are starting to become paperless. So you may notice that some consumables starting to not have any insert in them, but on the box there will be QR codes that link to all of these resources. Okay, a lot of to IDEXX Learning Center, that's great. And then quick reference guide, that's great. Okay, so all of these answers are correct. You can learn them from the operator's guide. You can learn them from the Learning Center. You can look at the insert, which will become a QR code later on. But the quickest way and the easiest way that you can send a one-pager to a customer is the quick reference guide. So the quick reference guide will not only have information on how to use the test, but how to handle the test as well. So you can see, for example, it also have everything that we just went through before. How long can we store it? What sample type can we use? What species is supported? So for every single special test on the catalyst, there will be a quick reference guide available. You can just search it on Google or go to the IDEXX website. Okay, and back to you, Lem.
So this is how the vets are going to use the cortisol test. Okay, so there are three protocols that they can do. So first one is the LDDST and then the HDDST, which are both three test protocols. So it is called three test protocol because they have to collect three samples to be able to come up with a result. Okay, so to run an LDDST, they have to collect a baseline cortisol sample or the 0 hour, what we call it. Now, after that, they're going to inject this dosage of dexamethasone, which is a steroid. And then 4 hours after injection, they are going to collect a second blood sample. Okay. Now, 8 hours after injection, they're going to collect a third blood sample. So this 4 hour sample is necessary to figure out where the problem lies. Is it in this part, in the manager part, or the employee part? Okay. So running an HDDST is the same. The only difference is that the dosage of dexamethasone is much higher than LDDST. Okay. So it's 0.01 against 0.1. Now, when it comes to the two-test protocol, okay, it is called the ACTH stimulation test. Basically, what the vet is trying to do is they're trying to stimulate this part of the brain that produces this hormone. Okay? So they only need two samples for this, a pre-ACTH sample, and then after injection of a synthetic ACTH, they are going to collect another sample 1 hour after that administration. So this is what we call the two-test protocol. So for hypoadrenocorticism, or like the Addison's disease, the cortisol test is mainly going to be used for ruling out the possibility that what they're dealing with is Addison's disease. So after the vet has gone through all of these steps, and then they proceed to rule out the possibility of Addison's, if cortisol is greater than 2, then they go back to their differentials. Now, if the cortisol is less than 2, then they would diagnose it using the two-test protocol or the ACTH stimulation test. And then once they come up with the diagnosis, the monitoring would be using the single slides for sodium and potassium. And the use of cortisol would end around here. In Cushing's disease, the cortisol test would be used more often. So again, after the veterinarian has gone through all the steps, then they could diagnose using the three-test protocol. And based on the patterns that they would see, they could characterize whether the problem is in the brain or the adrenal gland itself. Now, after they have figured this out, the monitoring would also be using the cortisol slides, but the two-test protocol would be used. Is that clear? Okay, if you have any questions, then I think we have some time in the end for that. Okay?
So just going back to the protocols a little bit, I think it's not that we have to remember the protocols and when to use it. That's mostly the vet's part. And similarly, I think countries that already had trials or launched it, like in the Europe or the US, it's been the same feedback, is that the vets already know these protocols for the most part. But then we also have resources to help the vets guide through how to use or when to use each protocols as well. which we'll share to you guys at the end. So everybody's the same at the moment. We're like, oh, what's going on? There's so many things to run. So don't worry. I would say that even the vet, even I'm not sure about you, Lem, but even for me, when we talk about cortisol testing, I always have to go back and read the text to review.
Yeah.
Because not only when to use, but the interpretation is also quite complex as well. Okay, so here's another question, and then we already have the answer here. So if a customer asks, how do I know if it's accurate, or have you done any testing on the accuracy, then we do want to guide them to the white paper. Oops, sorry. So the white paper is available for all of the catalyst special tests and cortisol included. So you can just go to, similarly, you can just search on Google or go to the IDEXX website. And I'll go through a little bit on what these means. So white paper usually have internal validations that we do to check for the accuracy of the test. So every single test that we do on the catalyst, typically we'll have a reference or gold standard method that globally people use to say that, okay, this instrument or this machine have the best accuracy to measure these tests. And the gold standard will different depending on the test, but usually hormonal profiles or hormonal test will use an instrument called the Imulite as a gold standard. So we tested the cortisol against the Imulite, and you can see that if it aligns, if the values align perfectly, they'll both be on the dotted line in the middle here. So that's really very little bias, and most of these are coming from when it's extremely high, which is usually outside the range we use for diagnosis. But typically, for example, if the catalyst says we've got a 5 cortisol, then you'd expect the Imulite to also give similar results, which is 5. And the second part of the white paper is called a precision study. And a precision study, basically, we run the same sample on the same instrument multiple times, and you should come back with similar values. And if you have quite a high deviation or CV, then that means your test is not precise. So that means even if you have the same sample and you run it on the same instrument, you may not get an accurate result. But here with the cortisol, we also have a precise test. And then lastly, it's called a specificity study. So this will vary a little bit different depending on each test. So for the cortisol, since when we are doing the cortisol testing, we are introducing steroids or dexamethasone in the protocol. So we don't want our cortisol test to be cross-reacting with these steroids. So that's why we tested to see if it cross-reacts with any other steroids. And I just want to highlight that there are some steroids that it does cross-react with. For example, these 3 up here. But this is the same with the reference method on the Imulite, is that they also cross-react with these steroids as well. And similarly, we also tested with dexamethasone, and it does not cross-react with dexamethasone. Otherwise, you're not going to be able to do the test. But medications that do cross-react are prednisolone and prednisone. And similarly, this is the same with the Imulite as well. And then lastly, we also do sensitivity to interference. So basically, we introduce interference, which are lipemia, icterus, and hemolysis into the sample. And then we run cortisol to see how it affects. And the good thing is that typically in cases of Cushing's, we tend to see a lipemic sample. But in the catalyst cortisol's case, lipemia doesn't affect the values at all. But just bear in mind that icterus and hemolysis do have some effect on the catalyst cortisol. So high levels of icterus can cause some variation in the cortisol level. And the interesting one is that hemolysis do affect cortisol when it's at a lower concentration. So if you look at the graph, you can see that we tested cortisol at the low concentration and a high concentration. And with icterus, it affects both, but with hemolysis, it only affects low concentration. So you can see it should be around 2.15, but with hemolysis, they tend to increase a little bit. But with the high concentration, it doesn't affect as much. So just a small quiz for you guys. Let's have a look at sample number 1. So if we have sample number 1, which is this tube, and this is an icteric sample, do you think this will affect the cortisol level that we run? You can open your mic to answer, or you can just type in a chat. Yes, thank you. So yes, it will increase. Yeah, just keep in mind that in some sample, we do see that most of them will increase, but some sample actually also decreases the cortisol level as well. Okay, what about sample number 2? So what kind of interference is this, and how do you think it will affect the results? I'll just give a hint that this is a hemolytic sample. So how do you think this will affect the cortisol level? Yes. Oh, very specific. Yes, thank you. Increase in low concentrations of cortisol. So if it's a Cushing's case where the cortisol is likely, when we measure, it's likely going to be high, it might not be much of a concern, but then it will likely have some effects on Addison's case. Okay, and then lastly, this is a lipemic sample. So how will it affect the result if we have sample, which is the second tube here? Any answers? Oh, yeah, just a reminder that, yes, thank you, Kelvin. So lipemic sample will typically be okay with the catalyst cortisol. Oh, thank you for all your answers. Okay, now let's have a look at some enhancements that we did to the IVLS to run a catalyst cortisol. So basically, when we want to run a sample, when we are going to run catalyst cortisol, we do the same thing with every test. We initiate the run on the IVLS first. So let's say we add a new patient here, and the patient's name is test 1, and it's a dog. We press next. And the first change you're going to see is that when you press catalyst 1 here, there is a button for cortisol added here. And once you press cortisol here, the vets have a menu to choose what kind of protocol they want to run. So for example, let's do an LDDST. So once we select LDDST, it will pre-select all the tests that we need to do. And the vets know immediately how many samples they need to collect and when they need to collect it. So they can just press save. And you can see that since we need to run 3 samples, now we have all the 3 runs already queued up in the IDEXX. So after this, we just press run. And you see all 3 runs have been queued up in process here. And the baseline, the 0 hour or the pre-DEXA is already sent to the instrument. So now they only have to go to the front of the catalyst, put in your consumables, close the sample drawer, and press start. So in this scenario, the only added workflow is they do have to select cortisol before they run, and then they do have to select the protocol that they want to run. And then after it finishes running, you notice that all the queue tests have turned to green. The catalyst icon have turned back to ready. So when they want to do the 4-hour dexamethasone run, they do have to initiate the run first by pressing Q and pressing start run. And it does need to change to a yellow, and then this needs to change to add instrument first before they put in the consumables. So that means if they have maybe an emergency case in between the runs, they do have the option to run other samples in between. Now, so this is in the scenario where the customer pre-selected the cortisol. And the results will look something like this. So you see that because they pre-selected and all the runs were queued together, they will get quite a long interpretive guidelines for this. So the vets also have these automatically interpreted for them as well. And this is the workflow enhancements that we recommend to do for the best experience is to do the pre-run selection of cortisol here so that they choose and the IDEXX knows which protocol they want to use, and it will automatically give an interpretive guide at the end as well. And these have been met with very positive feedbacks from customers who did the trials in the US and Europe. Yeah, so you can see like here, all of the runs have been queued together. And in between, if they want to run other patients, they can still choose to do so. Now, what if the customer did not choose cortisol in the beginning, but they did put in the cortisol slide? So I'll just skip to number 5 for now. Is that even if they didn't pick cortisol at the start, but they put in a cortisol slide, they'll still have a pop-up to ask, like you see here, that a cortisol slide has been detected and which protocol they want to run. So you can see here that since because they didn't select in the beginning, they can only select one protocol and then submit. So because they only did one protocol, if they didn't select and they only added new tests later, then the results will be a separate report. And if that happens, the customers are not going to get the interpretive comments. So this is why we also have the automatic append function, is that if the customer select cortisol and then, or even if they didn't select cortisol, but the IDEXX discovered that there's been a recent result of cortisol in the past, then it will ask if you want to append. So the function isn't actually that it automatically appends, but it will automatically ask if you want to append or combine the results together. Because if you run them separately, then you're not going to get any interpretive comments. So you do need to append or combine the results together to get the interpretive comments. So you see that in this way, the customers can still run the catalyst cortisol, though there are a few more workflows that they need to do. So just going back, it is recommended for them to pre-select cortisol and pre-select the protocol before the run to have the best experience. And so Van An had a question. So customers can also collect all the samples at once before running the cortisol. But one thing to keep in mind is that with the same with every other chemistry slide, we only recommend to store the sample at room temperature for 8 hours. So that means that in some protocols, for example, with LDDST and HDDST, where it requires to take an 8 hours post-stimulation sample, it may be slightly too long and they may experience some variation or inaccuracies in the results. So it's better to take the sample and run it right away. Okay, and then let's have a look at some software prerequisites. So Catalyst 1, at least 2.3 is needed. And for the IVLS, at least 5.25 is needed. And by this time, I would expect that most or all of your customers who are online in Smart Service will have been upgraded at least to this version or would have been upgraded past this version by now. But just keep in mind that the new cortisol workflow that I just showed you guys is going to be available in the later version, which is the 6.4 IVLS version. And the 6.4 version is actually being pushed as of yesterday into our regions. So some of your customer might have already received this update yesterday, but then it is gradually being pushed automatically through Smart Service within October. So by the end of October, I would expect that most customer would have received the IVLS upgrade to 6.4 already. Now, if the customer is still above 5.25, but still under 6.4, they can still use the catalyst cortisol, just that the workflow will be the same with other biochemistry tests. And then they have to choose the protocol after the run instead. So I'll just go back to show you guys that it will be the post-run selection instead, and it won't be as detailed as this. They only have the option to choose from a drop-down menu what kind of protocol they tested. So that means that if you have a customer that you visited and you know that they just ordered a catalyst cortisol test, then it is a good idea to go through them to upgrade the IVLS to at least a 6.4 and then just briefly go through them how the workflow is best for them to use a little bit. Okay, and then last document question is, if a customer asks if we have any guide on how to interpret the cortisol results, which resource are you going to use? So while we're waiting for these answers to come in, so we do have a question. If storing a sample, then I can share you the guidelines for sample storage later, but for cortisol, it is run cortisol slide. So for cortisol, it's not recommended to store in the fridge for over 24 hours. So storing samples in the refrigerator up to 48 hours is the general guidelines, but at the end, it depends on each individual biochemistry test. So for cortisol, it's not recommended to store over 24 hours. Okay, testing guide and algorithm. Thank you for the answer. Yes, so, whoops. So if customers want to know about how to interpret the results, we do have an algorithm. Or for cortisol, it's actually called a clinical reference guide, because if you guys follow the link, or if you've already downloaded the link from Jerry's email, then you will see that the algorithm for cortisol is like 5 pages long, whereas typically all the other tests will be only a 1-pager. And yeah, like we discussed before, because diagnosis and interpretation of cortisol testing is slightly more complex than the other testing, that's why it is slightly longer than all the other special tests. Okay, and then that's it. So I'm not sure if we have some time left, or let's move before we move on to some activities. Do you guys have any questions about the catalyst cortisol at the moment?
You guys can use the chat box or unmute if you have any questions.
If no questions for now, let's do. So I do have a little bit of activity for you. So for example, oh, okay, one question here. So the question is that if the slide is not ready at the clinic, what's the longest timing recommend for best results? So in general, for best results, just remember that fresh is best. So the best result is to collect a fresh result. So even if the guideline says we can store it for in the fridge for 1 hour, or at room temperature for 8 hours, it doesn't mean that we would recommend them to do like that. So usually it's best if they just get the freshest sample as possible. Yep, sure. You can, if you want to unmute and ask, that's fine. Your mic is unmuted, but we don't hear you. Any quality control
Can you
needed?
hear me now?
Okay. Yes.
Okay. So good morning, everyone. So my question is, because in Vietnam, the cortisol slide is not using that much. So just in case that they will order just when they need it. So I mean that what is the longest time that they can like store the samples? I mean.
They can store the sample in the refrigerator up to 24 hours.
So 24 hours will be the longest timing that
Yes.
you recommend, right? Okay, so thank you. Yeah.
Yeah, you're welcome. So also a question that is there any specific quality control needed? So if you've already moved to the Catalyst Smart QC, then you don't need any other quality control needed.
Hello, good morning.
Hello, hi Ernest.
Yes, for the results monitoring, so the patient should be on the clinic for the cortisol test monitoring, like in the 4 hour and the 8 hour run.
Yes. Yes.
Yes, yeah, that's
So that
usually the case, is that when they're doing this testing, they do need to schedule them to be in the hospital for the whole day.
okay, thank you, thank you.
Yeah, you're welcome. The old QC clip. Let me just check on which lamp group the cortisol is in. I'll just take note of that. This cortisol. But likely it's in the same with SDMA, so the old QC clip will also work as well. And is it possible if the cortisol show errors? So with every other test on the catalyst, if the results are suppressed, or if you don't see any results, we do need to check the errors first, because it could be errors relating to sample quality or sample issue. So yeah, that's the first thing, is that just check your event log if they forgot to see what error showed up at the end of the run to see, because there is quite a wide variety of reasons why it could cause results to be suppressed. Yes, we are going to share the recording and the training after the session. Any other questions? Okay, if nothing for now, maybe we can go through one or two of these.
Hi, sorry,
itineraries.
Simin here from
Hi,
Arakan.
Simin.
I do have one question.
Sure.
It's a pretty weird one. I have customers, even back then when SNAP cortisol is still in use, they like to compare it with BioNote results. And I do notice that there is quite a huge discrepancy in terms of results from both analyzers. So assuming that this would also be the case, can I say that, with QC done and QC result is in check, our result should be validated compared to BioNote?
Yeah, that's the same protocol that we do, is that not only with the QC, but with the white paper, that we have a comparison of our catalyst cortisol with the reference method. Then we do recommend them to trust our results. So usually we won't say anything about the other. Yeah.
Thank you.
Yeah, you're welcome.
Can I also ask, Jimin, do you have the SNAP cortisol in your country?
Yes, I do. I still have I think 5 or 6 active snapshot DX in the market.
Okay.
But none of them are using a lot of SNAP except for 2 customers.
Okay. And based on the question you ask, the comparison, no matter is either with the competitor or even the SNAP, because we don't recommend they do those comparisons because the technology is different, the methodology also is different. So don't suggest those. But in case they do have some follow-up case to the monitoring or the adjustment, the treatment, those still based on the clinical sign, which is really critical. And for the number, definitely both even the SNAP and the catalyst will expected probably was slightly different, but still will be based on the clinical sign.
Okay, understood. Thank you.
Thank you, Jerry, and thanks, Jimin, for the question. I think that will be a very common thing we see in the market as we launch any new products. Okay, so so this was already answered in one of the questions, is that if a customer already collected the samples, then they can still run it normally. So it's fine if they pre-collect the sample before, just try to make sure that it's within the time that we recommend to store the samples. Oh, whoops. Lem, can you just help me move it to the end? Yeah. Okay, so let's say this is a nurse or a technician who called in, and then they told you that, okay, the vet just told me to run cortisol. Do I need to do anything special? They didn't tell me any details. How would you respond to this question? And the emotion of the person asking will be similar to the picture that you see on screen. So they're not angry or anything in this case. Anybody want to answer? We do have some time left, right, Lem? Can you just check the time for me?
Yes,
Good.
we do.
Okay. Okay, no answers for this one. Okay, maybe I will help with this one. Or maybe Lem, what about you? How you? Okay, one answer. Yes. Okay. So yeah, so with the new cortisol workflow, the important thing is to select cortisol before running the catalyst. But just keep in mind that it's okay if they already run it without pre-selecting. They also have the option to select the protocol after the run as well. So even if they didn't know which protocol to use, they can run it now and then just, walk to ask the vet later what protocol they want to run later. But just that they can have the best experience if they pre-select the cortisol run. Okay, great job. Next one. Kind of more angry tone for this question. So if you went into talk and they say, oh, if workflow is so complicated, can I just do it like what I usually do with the other test? Oh, whoops, sorry. What will be the answer for this one? How will you answer? And I think the key thing is that they ask, can I just do it like normal or what I usually do? I'll give you guys a few seconds to think on it. Yeah.
Yes.
Yeah, exactly. So yeah, they can just run it like normally, like they usually do with biochemistry test. They don't have to pre-select the cortisol if they feel the workflow becomes more complicated for them. And then they have the option to select the protocol after the result has been done. But I think if you're on site and you have some cortisol tests to show them, then maybe it's also a good opportunity to show that the workflow actually gets simplified if they run if they select cortisol before running the test. But yeah, it's their choice to do it the other way if they don't like the first way. Okay, now we're back to kind of asking for help type question. So I've collected a green top and a red top tube, and I want to do Chem 10, Light 4, and cortisol. But how do I put in 2 samples? Any answers? What do you guys think? They collected 2 tubes and they want to put in 2 samples. Maybe one in the cup and one in a whole blood separator. And that will return an error, by the way, if you guys haven't encountered it before. Okay, so I'll just go through some of these answers for you guys. So many of the previously methods to run cortisol that our customers have in the market require them to collect a serum sample. Yeah, exactly. So, but our catalyst, they can use serum, plasma, or whole blood separator. So that means there's no need for them to collect a separate tube anymore. They can only just collect from a heparin tube or the green top tube, and then they just run it with only that. So they don't need 2 separate tubes anymore. Because, for example, in the past, let's say they run cortisol on a snapshot or some other competitor's instrument. And if they want to do both biochemistry and cortisol, they're going to need to collect 2 samples. So one in a green top and one in a red top. But now our workflow has simplified this for them. So they only need the sample in the green top or the heparin tube. And then they just run it on the catalyst all in one. So they don't need to run both samples anymore. In the case that they already collected the sample, both samples to run, then it's like what you answered, Kelvin. They can just use any of the sample that they already collected. So thank you for the answer. And I think this is the last one. So they were complaining, I want to run LDDST. There's no huge run like we mentioned at the training. Something must be wrong, and can you just come and swap or fix the machine? I have a lot of cases waiting. And obviously this is a really angry customer. So what do you think happened here?
The IBLS is not yet on the 6.4.
Yeah, great, very great job. Yeah, very good
And
catch on that one.
you could
What
just
if it's
append
already
the
6.4?
yeah, you could just append the results for the 4-hour and 8-hour run.
Yep. Yeah, good job. So, could be a few things. Maybe they weren't upgraded to 6.4, like Ernest mentioned, or maybe they did not pre-select cortisol when they chose catalyst. So I really like how you also provide them the solution is that they can still run it normally, and then they can just append into the previous result. And then it will actually automatically ask if they want to append to the previous result in this case. So great job, everyone. Thank you for the answers. Yes, Jerry.
Yes, I just wondering for the IDEXX software 6.45, for those upgrade, they will have like the feature pop up those the cortisol the diagnosis, the interpretation, those. Do we also need to have arrange some like the deployment for the customer, or they can do that from their side themselves?
Yeah, they can do it on their site themselves. So it'll be the same as with other upgrades.
Okay.
So yeah, it'll automatically pop up and tell them that that's a new upgrade available.
Okay. Okay.
Oh, one more. So maybe they ask you and they say, I run cortisol, but there's an error after the run. And then this is the, oops, this is the error that they showed you. So maybe it's actually not an error, but maybe they were just trained on the new workflow, the enhanced workflow of the cortisol. So yeah, this is quite an easy one. You just ask for the picture for them to show you. Okay, back to you, Lem.
Right. So thanks for the participation, everyone. So, well, as you may all know, that the catalyst cortisol is just one of the many additions that we had catalyst on the catalyst one, and there's definitely going to be more. Now, what we need you guys to take away from this is really just that the catalyst cortisol is like any other test that we have is very accurate and precise, and also it's very quick. The results can be given to the customers in less than 15 minutes. And uh, if you have any experience running cortisol on our competitors, this is a very simplified workflow. And what's great about the catalyst cortisol as well is that it doesn't cross react with the medication that is needed to diagnose with the disease. Okay. So